Welcome. Come with me. The doctors will see you now.
Welcome back to another episode of Fast Talks with Family Docs. I'm Dr. Phil Palmer.
And I'm Dr. Virodala.
Good
We're
to have
today.
you joining us again. And we're going to be technologically driven instead of in person for this episode. We are joined by two guests tonight. But Veer, before we introduce our guests, I just want to give a shout out to a family doc that we both know and recognize him and his contribution. So I want to recognize Dr. Tomas Owens, who practices at Integris Baptist in Oklahoma City. Dr. Owens is being recognized by the Oklahoma County Medical Society with the Reinhardt Award. And this is really a big deal. The Reinhardt Award is given annually to members who've made significant contributions in improving healthcare, enriching the community, or advancing the welfare of the state. And Dr. Owens, over his career, has just been a dynamo and a huge moving force in improving healthcare within the city of Oklahoma and across the state. And so I just want to give a shout out to Dr. Owens, recognizing a family doc, getting honored in this great way. So congratulations, Dr. Owens, to you.
Yeah, I definitely
So
couldn't think of a doc more deserving. He's so incredible, and we're very proud of him.
Yep, amazing,
for
Dr. Owens.
sure, Dr. Vidala,
Yes,
do you want
sir.
to introduce our guests?
Yeah, so today, guys, thank you for joining us. We're going to be tackling one of the biggest issues of the year, the Oklahoma legislative session, and what's coming down in the pipeline for family physicians. So joining us today are two people that are in very much the thick of it. Don Watson, who's the OAFP's lobbyist at the Capitol, and of course, Kari Webber, Executive Vice President of the OAFP.
We're
Thanks
so
for
glad you
having
guys are joining us this evening.
Thanks for having us.
Awesome. So, Ms. Dawn, let's set the stage. We'll start with you. The 2026 session begins February 2nd and runs through late May. So, unless there's only early adjournments for the campaign season. So what kind of session are we walking into this year?
So it is the second year of the legislative session or legislature. So that means that we have carryover bills from the year before and we have new bills this year. So we're looking at about 5,000 bills, and the OAFP itself is tracking more than 400 bills. That does not include shell bills that don't have language yet or anything new that gets amended or added as we go. So it's very busy, and as usual, healthcare is a very hot topic and a lot of bills to look at right now.
Wow. Okay. Um, and OFP is alone tracking how many of those bills?
More than 400 we have tracking on a variety of healthcare topics. So,
Wow.
Going to be a very busy session.
yes.
Yeah.
Kari, would you start us off addressing a bill that's very important to the Academy because of its focus on primary care, House Bill 4453, authored by Representative Newton and co-authored by Senator Rader. Tell us what that bill's thrust is.
Yeah, so we're really excited about this bill. Obviously, we're really excited to work with Representative Newton again. He's been an incredible champion for family medicine in our state and just the state of healthcare in general. But this bill takes that 11% increase in primary care that we got in Medicaid, and it replicates it into the commercial insurance space. So we want to make sure that primary care investment is something that is valued across the board, right? Not just in Medicaid, but in those commercial plans as well. And so this bill calls for an increase in the primary care overall spend to 11% to replicate the exact same thing that we asked for in Medicaid in that commercial space. And then there are several other things that this bill asks for that I think are really important aspects to this primary care investment. One being an APCD or an all payers claims database. One of the things that we're lacking here in Oklahoma is data, right? Like data drives everything. And we can't make improvements or changes unless we have the accurate data to support anything that we're doing. So, with Medicaid, it was really easy to pull the primary care data, right? Like we just put in the request for that and they were able to pull the primary care spend. It took a little bit of time of figuring out what was included, but they were able to pull that. Now in the commercial space, you're dealing with multiple agency or insurance companies, and because we don't have a mandatory right now, all payers claims database is not an easy way to pull that information. So you're seeing this move across a lot of states nationwide to have an all payers claims database. So we went ahead and put that in the bill. And this just helps us be able to measure spend across the board in every category, specifically, obviously, focus on primary care. And then the other portion of this bill is to create a primary care transparency bill or board. Slash commission. I don't know what they'll end up calling it, but it is created with representatives from the OAFP, the OKAAP, the Oklahoma Primary Care Association, as well as like the Insurance Association, the Insurance Commissioner, Medicaid, the private insurance companies, to really look at what is that primary care investment and how can we strategically make strides in reaching that across the board. So this bill is really focused on taking what we have and investing in our primary care specialty here in the state and improving, hopefully, the health of all Oklahomans. So we're really very excited about the bill, and it kind of touches on a lot of different things.
Amazing.
That's excellent news. That sounds like a great step forward because I know the discussion with last year's bill putting that 11% requirement for Medicaid was how are we really going to track and make sure it's being done, especially with three entities in the state providing care to the Medicaid population. And so I think this will be a huge step in that direction and making things better. So very excited to see this move forward, and hopefully it's well received at the Capitol.
Yeah, I think one of the great things right now is we put in a lot of work as an academy, as the family docs to try to, I don't know, prime the legislature on the importance of primary care and preventative care
Yep.
in the interim session in the past couple of years. And I honestly, and Don can maybe speak but I think that our legislature understands the importance of primary care, and we just have to work to kind of add in things that would help enhance it, right? I think they get it. We just have to figure out how do we want to make the biggest impact, and it's one bill at a time, but this is a
Right.
step in that direction.
Yeah. I think the legislature is a lot more understanding of primary care than they have been in the past, and also preventative care and how it helps the patient more and then also ends up saving money in the long run.
Yeah, that's fantastic news, guys. I just heard read a quote today that, prevention isn't loud. And so when you don't hear about it, it means we're not having any problems, right? And so
Right.
I think it's the step in the right direction. Speaking of about prevention, a lot of the issues we have as primary care docs is trying to have resources and take care of our patients who are on Medicaid or on the managed Medicaid teams, and having to deal with the limited resources they have. And I know there's going to be bills about that this session. Ms. Dawn, do you have any news on that for us?
Sure. We have had discussions about Medicaid. I know the agency will have a budget hearing coming up soon about what they're sort of seeing on the federal level and some of the cuts that are coming. I know our budget folks have been thinking about that. Kari and I had a couple of meetings ahead of session with budget people to talk about how we prepare and that sort of thing. There are a couple of bills that we will definitely be watching. One in particular which would put a vote to the people to not pay for the expansion population if the federal government makes cuts. So all of that is, we'll see how that shakes out and be watching that very closely, of course.
Yeah, I think you're going to continue to see just across the board. I mean, Dawn and I were at the state chamber luncheon today, and this was a huge topic of the rising costs of insurance and healthcare. And um, even outside of Medicaid, right? But the Medicaid portion is really big. So when we're looking at like potential repeal or potential non-coverage of some of those patients, we're talking about high. What people I don't think realize is like when you start taking coverage back, our costs don't go lower, right?
Right.
They actually skyrocket, right? Because then we have more people in the emergency room, less people doing preventative care, and less people seeking their primary care providers. And so I think that's a really important thing for us to continue to be able to educate our legislators on is like when you repeal or you take back coverage from certain people, it doesn't save us money. It actually costs us money. And so I think that's going to be a big part of Dawn and I's rhetoric as we move through this legislative session when we talk about these bills.
Awesome.
Very, very good. And then, talking about money and the cost of healthcare, there's a big pot of money that Oklahoma has related back to decades ago with a lawsuit against big tobacco companies. And that tobacco settlement money in Oklahoma was used to create an endowment trust, TSET for short. Kari, how's Oklahoma compare to all the other states that were involved in that lawsuit decades ago?
Yeah, so TSET in Oklahoma is the only state that still has funding left from that large settlement. It was a lot of money that went to a lot of states in that settlement, but the way that Oklahoma invested that money into the tobacco settlement endowment trust has paid for multiple years, and it has helped in improving our tobacco cessation and our healthcare numbers. There's a lot of things that TSET does that a lot of people don't realize. They help contribute money to our physician loan repayment program, formerly known as PMTC. I think it's now HWTC, but they contribute to that. They're giving grants out to healthcare entities and services that support healthcare in our state. I believe that youth medical mentorship that is encouraging students for
Yep.
medical positions just got a nice grant from them. And so I think they're doing a lot of incredible work that people don't realize through that. But because of that continued funding and the way that we structured that endowment that was voted on by the people in the state of Oklahoma, we've been able to make significant strides in a lot of different areas because of that. Now, because of that money being there, there's a lot of people that want to come after it. I think Don could probably talk a little bit about some of the bills that we're facing this session in regards to people looking for that TSEP money or to be able to use that TSEP money for purposes that it wasn't intended for.
Yes, we definitely are tracking a few bills related to the Tobacco Settlement Endowment Trust. One that would change the makeup of the board and how that's set up and how their appointments go, and a couple that would make changes to where the money goes and that sort of thing. So I think that the people have actually voted twice to keep that money the way that it is, as we had a vote of the people not very long ago to reaffirm all of that. So, and it does, as Kari said, it does so much. I mean, not just in grants to communities and all of that work, but then also cancer trials across the state are funded through TSET. So, everything from, cutting edge cancer treatment to primary care to, rural access and even, I believe, at some point, residencies. So, I think that's something that the OAFP definitely has had a long history with and definitely will be watching very, very closely.
Awesome. Thank you, guys.
And
Well, every
I was just
session.
going to say,
Sorry. Yeah.
Beer, sorry to interrupt there. I was just going to say that I think that's very important for our listeners, our viewing audience to be aware of and pay attention to that. On one hand, there is billions of dollars, if I understand correctly, in the TSET fund. So it's grown phenomenally over the last couple of decades. And so to look at that money and say, do we need to maybe make some changes and spend some of this money in ways to further reduce the influence of tobacco in the state or to improve healthcare? I don't think it's at all wrong to have conversations about that and be intentional in maybe considering ways to spend a small portion of that money. But Kari, I think your comment at the beginning is the most telling one, in that a lot of other states started dipping into their money over the last couple of decades, and that money is all gone now. And
Yeah.
so, although we shouldn't have an attitude of never spend it, it's there for a reason. I think we continually look at what appropriate reasons are, but there's some legislation I've seen out there that I think is going to let the legislature dip their hand in that honey pot way too deep and way too often. And so I think it's important for all the docs and people concerned about healthcare in the state to pay real close attention to all of these bills and give them some serious consideration, not just on would it be beneficial right now, but how is it going to impact that trust fund and the ability to do stuff 10, 20, 50 years in the future.
Yeah, and in other states, you've seen it used on like roads and other things that have nothing to do with healthcare. And when you look at our healthcare stats in Oklahoma, like we could use all the help we could get, right? So if we can put that money back into healthcare, that would be extremely important. And I think too, a lot of people don't know the deep history that the OAFP has with the establishment of TSET. The OAFP was very instrumental in that lawsuit and the establishment of that endowment, um, in hopes that it would have this exact effect, right? Like it would be able to impact generations to come in health impacts. And we definitely should bring on Julie and Dr. Crawford at some point to talk about the history of that. But I think that's important to note that the OAFP was very instrumental in the creation of this endowment trust and the way that it came about. And so obviously it's something we're very passionate about protecting.
No, you guys
Yeah.
are right. I mean, honestly, how many of our students or residents know what TSET is? You
Yeah.
know, that might be something we put on at least on our Instagram social media page and reach out to maybe reach the audience of the younger crowd so they actually know the history of the bill and what it means. But yeah, uh, you guys okay to move on to the next topic? I
Definitely.
guess scope of practice is always something we discuss each session. What are we looking at this session, y'all?
You want me to take that one, Carrie?
Yeah, go for it.
So we do have a few scope bills that are related to APRNs and PAs. They do appear to be cleanup language. Of course, we will be looking very closely at that language to making sure. I think there was some things that needed to be resolved around allowing pharmacists to fill prescriptions that PAs and APRNs write. That's what we were told. And so we're looking at those to make sure. And then also, of course, we still have carryovers from last year, pharmacists test and treat. We've got chiropractors. We've got we've got unmatched medical students practicing under supervision. We have several different bills still left over from last year, and let's see, psychologists prescribing. Uh, just several different things that always we're watching to, make sure that things go as they should.
Yeah, thank you, Dawn. That's it's a never-ending battle, so to speak.
Yeah.
But it's an important issue that we need to stay on top of to make sure that the citizens of our state are getting the best health care in the best setting by the best people.
Yep.
And so I know there's always differences of opinions about that, but as with anything, when you get a legislature making these decisions instead of a board of licensure making these decisions, other interests can get involved, and non-medical people struggle to understand the medical realm and the risk involved. So
Right.
thank you for being a resource for us in regarding all those issues.
Of course.
So related to that, there's always hot button topics every year, and really since COVID, vaccines have been one of those hot issues that we see multiple bills introduced, and this year is no exception. We have several bills related to vaccines, bills related to medications for treating certain issues, and what's your gestalt at this point as you've looked at some of the bills that have been introduced and or bills that are being carried over from last year that members of the academy and members of the medical community need to be aware of and paying attention to?
Sure. I think that there are a wide array. There are a couple that would affect COVID and RSV vaccinations, immunizations. So I think those might be the ones that we would be paying really the closest attention to on immunizations. There's actually a nice one around the flu, and having hospitals offer a flu immunization for people before they leave. Uh, so there,
Good.
it's not all bad. I think it remains to be seen what will happen. We will definitely be letting people know which ones are moving, and if we, need some calls or emails, because obviously that can make a huge difference. Um, and I think they're they're going to continue. And I think, as you said, Dr. Palmer, after COVID, it just became more of a heated topic, and people are just not done with that yet. And there's a lot of education that we can do around that.
Yeah, I think there's over 30 that we're tracking that are anti some sort of immunization, right? I think Don was specifically looking at Senate Bill 1938 and Senate Bill 2017 when we're talking about the ones that could
Yes.
impact RSV and COVID. Um, but I think what we need to realize too is like some of the things that Don and I track maybe don't look like immunization bills, right? They're under the guise physicians conscience bills and or different things like that. And so I would encourage everyone to kind of keep their eye out for those things that could potentially impact um, your practice. We will continue to track those. Like I said, I think what'd you say, Dawn, 34? We have 34 that we're tracking.
Yeah, I think it is
Um,
34.
yeah, 34 immunization bills. And the Academy also works very closely with the Oklahoma Alliance of Healthy Families, along with the Oklahoma State Medical Association and the Oklahoma Osteopathic Association, and a whole band of other invested community members on this topic. And so we'll continue to follow those. But I definitely think this is going to continue when we have what's happening at a federal level. It's trickling down to a state level.
Right.
And our whole goal this session will be helping combat some of the misinformation. We've had some really incredible physicians in our community already doing that work on social media, just talking about the importance of immunizations. I think our goal is not really in our state to make it harder for anyone to opt out, right? Like we already have the most lax standards, but what we really need to think about is we don't want to impede or stop anyone who wants to get the vaccine, the ability to get the vaccine, right? And so that I think is the biggest stance for the Academy right now is just how do we protect the current standards that we have in place? We don't need to try to fight back and make it harder to get to get exceptions. But we do definitely need to protect where we are at the moment.
And I think also it's good to note a few of these bills really get in between that or attempt to get in between that patient doctor relationship. And we definitely do not want that happening. And we don't want penalties for physicians and providers who are having conversations with their patients. That needs to happen, and the legislature does not need to be in that relationship, and that's been a long-standing stance of the OAFP for sure.
Well, and
Exactly.
I was just going to say, Dr. Palmer, from a physician's perspective, for you or Dr. Vidala, what we're hearing is, now you're spending more time combating some of the misinformation that has been spread due to the new vaccine recommendations at the federal level, like that it's harder to take care of your patients in your practice because you're spending more time dealing with that than you are about their health in general and other outcomes. So I don't know. I'd be curious to hear from a physician's perspective of how it's impacting your practice.
Well, it definitely takes more time and makes it harder to interact with the patient. I mean, educating patients regarding their health and educating patients regarding different recommendations for preventive care has always been a cornerstone of family medicine. And it does take some time because we've got to translate very technical things, medical words and compounds and what it does into lay language. But again, that's our desire. That's why we went into this field and why we're doing this. But there is some time and effort to do that and educate somebody. But unfortunately now, before we can really even attempt to educate them, we've got to spend twice as much time trying to address the brainwashing, I guess, that they received from social media and other things on the internet and other unreliable sources that are just presented as very convincing. And so we can't really even do the education until we've spent the time to try and address the wrong understandings they already have. And unfortunately, internet sources seem to get more credence than the physician you're sitting in the office with a lot of times, which is unfortunate.
Yeah, so that
Yeah.
would be my plug as an OAFP exec would be share those stories with your legislators. I mean, I think being able to explain some of those situations that you're in, I think, and being able to show real-time experience is really helpful. I mean, that's where I would say where we need our physicians the most when it comes to this legislative session is to actually share your experiences, your personal time with your patients and what it's doing to your practices. I think that makes probably the most impact. I think Dr. Vidal, you were going to say something. I don't want to cut you off.
Oh, no, it's like I was thinking about our partner saying is like, you create this environment of fear when the patient is even afraid to ask for help, that's doing patients harm. And I think that's what we have to really focus on this because we know science is real, vaccines are real, vaccines saves lives. There's like no other way around it. And we're seeing it in real life with the measles outbreak again and coming back into session and having an increase in rates of flu because people are like, oh, we don't know what's in it. Is it mercury? You know what I mean?
Yeah.
And there's just you got to break down the barriers, but I think it gives us at least an opportunity to be real with our patients and build that patient physician relationship again. But it takes time to build that trust again. That's the problem. Is this is harming that trust that the patients
Mm,
have.
yeah.
It's
Yeah.
difficult. I mean, everyone's a doctor now. They just go on ChatGPT. But it's like, it's not, ChatGPT, AI can confabulate, right? It's not all truth out there, but
Right.
speaking of AI, just to keep us moving, there's a couple of artificial intelligence bills out there, right?
Yes.
Like in the world of ambient scribes now, we've got AI being used in clinic, and then insurance
Hmm.
companies are using AI, so for prior auth. So what do you guys have to say about that?
So there are definitely a couple of bills. One in particular would require informed consent of use of artificial intelligence by healthcare professionals. And then another would seek to prohibit health insurance providers from issuing adverse insured outcomes via artificial intelligence. So it's like kind of, and it's the same author, and it's kind of on both sides there. Like if you're going to use it, you need to have informed consent. And if you're going to deny it, should not be by artificial intelligence, I guess, right?
Yeah.
Right.
So we will see if that makes any move and if there end up being any bills with that language added. I see artificial intelligence being discussed across the board, not just in healthcare at the legislature. So I would expect that to be a growing topic. I don't know if it will be a huge one this session or not, but I would expect more and more as we continue to go. So one for sure on our radar, Dr. Vidala, for sure.
And I've got to admit, as I read some of these bills that you guys sent out, I can only assume it's been artificial intelligence that wrote a lot of this. There doesn't seem to be any real intelligence involved. And
It helped me put together the spreadsheet. So, there are uses for it. There are definitely uses for it. But I think it's definitely one to keep an eye on. The the national organization's doing a lot of work in this space too, trying to help advise on the good uses and the benefits for physicians, because we do know that the physicians who are being able to use it in their practices, we know it's saving them time, right? I have a funny story of a physician of mine who I see, and he said he didn't realize how much time it was saving him until he realized he had eaten lunch for an entire week. And those are the kind of things that I think are really great. But we definitely don't want AI determining if a prior authorization goes through for a patient or not, right? We need the human interaction. So I think it's kind of give and take, and we'll have to, I think they're ever evolving, but we'll keep our pulse and our eye on all of those AI bills as they continue to move through the legislation.
Mm-hmm.
excellent. Well, Kari, before we wrap up, I'm curious, what is your advice, your recommendation as the most important takeaway for family docs that are listening to this episode?
Yeah, I think it's lean in to the OAFP, right? Like we are tracking 400 plus bills. If I send an alert, I promise it's because I need you to reach out and speak out to your legislators. We try not to bombard our physicians. I mean, we're not going to send an alert on all 400 bills that we're tracking, but the ones that are the most important, we hear all the time from the legislature when we're at the Capitol, like all we want to do is hear from your docs. And I think that's the most important thing. I tell people all the time, your opinion matters, your thoughts matter. Not only do you represent yourself, but you represent an entire cohort of patients in a community for a legislator. So you hold a little clout, and I think you should be proud of it. I also think family physicians are well positioned to take the really complex information that healthcare is and to break it down into terms that's easy for anyone to understand. And I think you do that by taking it and showing real life examples of how a bill can impact your practice. And so if we send those alerts, please, if you feel inclined, we'd love for you to share your voice. We'd love for you to join us at Medicine Day at the Capitol, Dawn, March 10th. Am I correct?
Yes.
March 10th, Medicine Day at the Capitol. Anytime that we put a call out, if there's still, I think, some times open for Physician of the Day, and we have sent that link out as well, and we'll continue to post that. But if you are interested, you can reach out to us at any time. Be sure to follow our new app. If you download it on any Apple or Android product, It's just OAFP app. You can find that. We will send legislative updates and push notifications throughout the session. But I think it's engaging and following along with us and activating when we put out a call for activation. And if you're more interested in serving in a bigger capacity, reach out. We have a legislative committee that I'm sure would love to have your participation.
I will add, if it's okay, Kari, that a lot of people think that it takes a lot of time, and it really does not. It takes very small amount of time to respond. It takes a small amount of time to develop a relationship with your legislator, because you will probably end up being the expert that they know in this field, and they will begin to ask you questions, and that is a big victory right there, when they ask you before they try to run something or before there's a big vote. And it really, an email every once in a while, a call every once in a while, it really is only 5-10 minutes at a time, and really that small amount of time every once in a while actually makes a huge difference. So the return on your time investment is huge.
And a pro tip is just to make sure anytime you're talking to your legislator to tell them that you're a constituent. I know that sounds really funny, but they can listen to anybody at the Capitol. But it makes a big difference when you make sure to point out that you're a constituent. If you don't know if you're a constituent, you can go to the state legislature page or okpolicy.org, and it's very simple to put in your zip code and your mailing address, and it will pull up who your representative and your senator are, and that's just a great way to start. So,
yeah.
Yes, thank you for that, and for walking us through, tiptoeing through the tulips, as it were, all these bills that are out there, and giving us a bird's eye view of what's going to be happening over the next few months. Thank you for that.
Well, we appreciate everything you guys do. Don and I will be there, probably drinking lots of coffee to stay on top of all of these bills. But we do appreciate the ability to come on the podcast and talk about these important issues. So thank you guys.
Yeah.
Thank you, guys.
Well, Dr. Vidala, wonderful working with you again, and to our listeners, thanks for being engaged with this podcast. And we will see you next time on Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.